I think it's, I think there are areas where legitimately we have counties in the country where the levels have gotten so low that the science would say you don't need to wear a mask here. I think in many other places, for some time now, it is we're tired of this and we're moving on. And I think politicians are even doing that. And the truth is probably somewhere in the middle of those two extremes. In some places, I think politicians are making decisions based on what's politically advantageous for them. And in other places, I think they're making decisions that, follow what we know to be true. And again, this also goes back to what your tolerance for risk is. And when you have 350 million people in the United States, all with a different opinion about something, some have very high tolerance for risk and some have none. And so collectively, we have to try to navigate those minefields. And I think, public health officials are going to err on the side of more caution. That's what they do. Their job is to keep the most people safe, keep the most people from dying. And then there are other people in our communities that have different motivations, different roles, and their view is a little bit different. And so all of those things have to come together. And I think that's been part of the challenge of the whole pandemic. I think it's part of the challenge of the messaging of the whole pandemic, which has not always been clear. And so hopefully as we get through this, we learn a lot of lessons on public health policy, on public health infrastructure, on public health messaging, and on human psychology that all will help us going forward. People yearn for an objective standard, an objective piece of information. And we get to here, we'll do this. We get to here, we'll do this, because it helps tell a story and it helps people understand where we're going. And at least there's something we can all shoot for. And I think what those groups realized is that, those are artificial cutoffs. Again, it goes back to what's your tolerance for risk. You have to have 5% of tests that are positive, or 7%, or 1%, or 0, or what's the number? And then I think that how rapid the decline has been, I probably changed the opinion of some of those people who had set hard targets. They said, we set this target, but this thing is declining so fast, and in some ways we've lost the public and the public health messaging. A large number of people are just ignoring it anyway. We're going to go ahead and move on this. And we're finding that while cases are really high, in general, disease is less severe. And we now have a large number of US adults either vaccinated or have had COVID. Now, that still leaves a large number of people. So let's say there are 260 million adults in the United States. Let's say 90% of them, let's just play with round numbers, have either been vaccinated or had COVID. That still leaves 26 million people who haven't had it. And Omicron will find everyone, particularly those unvaccinated or haven't had it. So I think public health officials are thinking, wow, that's still 26 million people. There's still a lot of people going to end up in the hospital. Let's be more cautious. But I think what they're finding is hospital numbers are declining rapidly. The case count is declining rapidly. The percentage of tests are declining rapidly. And so maybe those hard targets don't make as much sense, and decide to go ahead and move on it. And frankly, people were rushing past them anyway to not mask. And so they had very little control of the message or the actions of those individuals, and thought the better part of valor was to say, okay, let's back down now.